Are you finding yourself waking up at 3 a.m. and struggling to fall back asleep? You're not alone. Many older adults experience this frustrating pattern, and it's not just a random occurrence or a sign of aging. In this video, we'll explore 5 key reasons why this happens and what those early morning wake-ups might really mean for your health and sleep. From hormonal changes to shifts in your body's internal clock, we'll dive deep into the science and psychology behind these wake-ups. By the end of this video, you'll not only understand what's going on, but you'll also learn practical tips to improve your sleep and feel more rested. Stay tuned to discover how to work with your body's natural rhythms for better, more restorative sleep. First, decline in melatonin production. As we age, many people begin to experience changes in their sleep patterns, particularly waking up at 3 a.m. and struggling to fall back asleep. One of the primary reasons for this is the natural decline in melatonin production. Melatonin is a hormone produced by the pineal gland in the brain, which regulates the body's sleep-wake cycle, also known as the circadian rhythm. This hormone signals to your body when it's time to sleep, helping you fall asleep and stay asleep through the night. In younger individuals, melatonin is produced in a steady, strong rhythm, ensuring long, uninterrupted sleep. However, as we age, the body's melatonin production decreases. This drop in melatonin is one of the main reasons older adults wake up earlier, often around 3 a.m. By the time this early hour arrives, melatonin levels dip too low to maintain a restful sleep, and as a result, many older adults find themselves awake, fully alert, and unable to fall back asleep. Environmental factors can further exacerbate the issue. As people age, they become more sensitive to light and noise. Even small amounts of light, such as a street light outside the window, a blinking clock on the nightstand, or light coming from the hallway, can suppress melatonin production, making it harder to stay asleep. This increased sensitivity means that even minor light disturbances can cause the brain to signal that it's time to wake up, making it more challenging to stay in a deep sleep. For example, Harold, a 72-year-old man, used to consider himself a good sleeper. However, he began waking up around 3:15 a.m. most nights. At first, he assumed this was a sleep disorder, but after learning about the decline in melatonin with age, he realized it was simply part of aging. Harold then adjusted his bedroom environment by darkening the room, avoiding screens before bedtime, and taking a brief evening walk to reinforce his body's natural circadian rhythm. These simple changes helped reduce his early morning wake-ups. While this early waking is a natural part of aging, there are steps you can take to help manage the issue. One of the most effective ways to manage reduced melatonin levels is to minimize light exposure, especially in the evening. Avoid bright lights and screens an hour or two before bed, as they can interfere with melatonin production. Using blackout curtains or an eye mask can block out light and create a better sleep environment. In addition, establishing a consistent and relaxing bedtime routine can signal to your body that it's time to wind down. Activities like reading, taking a warm bath, or practicing relaxation techniques can help calm your mind and prepare you for sleep. Staying physically active during the day can also support your sleep by regulating your circadian rhythm. Aim for at least 30 minutes of moderate exercise daily, but avoid vigorous activity too close to bedtime, as it may disrupt your ability to wind down. In some cases, melatonin supplements can help support the body's sleep-wake cycle. However, it's essential to consult with a healthcare provider before using supplements to ensure they're safe for your needs. While melatonin supplements can be helpful, they should not be relied upon as a long-term solution but may provide temporary relief. Waking up at 3 a.m. is a common issue for older adults, often linked to the decline in melatonin production. While this shift in sleep patterns is natural, it can be frustrating. By understanding the reasons behind early morning wake-ups and making small adjustments to your environment and routine, you can improve your sleep quality. Managing light exposure, creating a calming bedtime routine, staying active during the day, and considering melatonin supplements can all help support better, more restful sleep. Second, shifted sleep cycle, advanced sleep phase. As people age, one of the common changes in sleep patterns is a shift in the circadian rhythm, known as advanced sleep phase. This shift causes older adults to feel sleepy earlier in the evening and wake up earlier in the morning, often around 3 a.m. While this can be frustrating, it is a natural biological change and not a sign of poor sleep quality. The circadian rhythm is the body's internal clock, which regulates the sleep-wake cycle. In younger individuals, the circadian rhythm typically aligns with a later bedtime and wake time, allowing for long, uninterrupted sleep. However, as we age, the rhythm naturally shifts earlier. This means older adults may begin feeling tired by 8 o'clock or 9 p.m., and by 3 a.m., they are fully awake and alert. This shift is not caused by sleep disorders but is a normal part of aging. There are several reasons why the circadian rhythm shifts with age. One major factor is the decrease in melatonin production, a hormone that helps regulate sleep. As melatonin levels naturally decline with age, the body's sleep-wake cycle also changes. Additionally, external cues like work schedules and social activities, which help regulate the circadian rhythm in younger years, are often reduced as people retire or experience quieter lifestyles, allowing the internal clock to shift. While waking up at 3 a.m. may feel inconvenient, it's important to understand that this shift in sleep patterns is not necessarily harmful. It's simply the body's way of adjusting over time. However, if the new sleep schedule is disruptive to daily life or social activities, there are several strategies to help manage the shift. One effective method is to adjust the evening routine. Since the body is naturally feeling sleepy earlier, try staying awake for an extra hour or two by engaging in relaxing activities such as reading, light stretching, or spending time with loved ones. Gradually shifting bedtime can help realign the circadian rhythm to a more desired sleep schedule. Another strategy is to increase exposure to natural light during the day. Daylight helps regulate the circadian rhythm, signaling to the body when it's time to be awake and alert. Spending time outdoors in the morning can help the body adjust to a later wake-up time. It's also helpful to limit light exposure in the evening, especially from screens like phones or computers. The blue light from these devices can interfere with melatonin production, making it harder for the body to wind down. Dimming the lights and engaging in quiet, calming activities in the hour before bed can signal to your brain that it's time to sleep. Lastly, maintaining a consistent sleep schedule can help reinforce the body's new rhythm. Going to bed and waking up at the same time every day, even on weekends, helps to stabilize the sleep-wake cycle. In conclusion, the natural shift in the circadian rhythm with age, leading to earlier bedtimes and early morning wake-ups around 3 a.m., is a common occurrence. While it may feel inconvenient, understanding that it's a biological change can help reduce frustration. By adjusting evening routines, increasing light exposure during the day, limiting light at night, and maintaining a consistent sleep schedule, older adults can manage this shift and improve the quality of their sleep. Third, physical discomfort and health issues. As we age, physical discomfort and health issues often disrupt sleep, leading to early wake-ups, often around 3 a.m. Conditions like arthritis, acid reflux, frequent urination, and medication side effects are common culprits. These issues cause discomfort, making it difficult to stay asleep, especially in the early morning hours when the body becomes more sensitive. Arthritis is one of the leading causes of sleep disturbances in older adults. It leads to pain and stiffness in the joints, which can worsen at night. This discomfort makes it harder to stay in one position for long periods, causing wake-ups, often around 3 a.m. The pain tends to intensify at night, disrupting sleep. Acid reflux, GERD, is another common problem. It occurs when stomach acid rises into the esophagus, causing a burning sensation. When lying down, the symptoms are often worse, leading to discomfort that interrupts sleep. Many older adults experience this more intensely during the early morning hours, which can result in waking up and difficulty returning to sleep. Frequent urination or nocturia is another issue. As we age, the bladder becomes less elastic, leading to the need to urinate more frequently at night. This often results in waking up around 3 a.m. to use the bathroom, especially if fluids are consumed close to bedtime. Medications can also affect sleep quality. Many older adults take medications for conditions like high blood pressure or diabetes, and some medications have side effects such as increased urination, dry mouth, or sleep disturbances. These can interfere with the body's ability to maintain restful sleep throughout the night. To manage these disruptions, several strategies can help. First, adjusting medication timing can make a big difference. For instance, taking diuretics earlier in the day may reduce nighttime urination. Similarly, adjusting pain medications to be taken before bed can help alleviate arthritis pain during the night. Improving sleep posture can also be beneficial. Sleeping with an elevated head can reduce acid reflux symptoms, while using pillows to support painful joints can minimize discomfort and help improve sleep. Managing fluid intake is another key adjustment. Limiting fluids before bed can reduce the likelihood of waking up to use the bathroom during the night, especially around 3 a.m. Lastly, incorporating relaxation techniques, like deep breathing or light stretching before bed, can help ease discomfort and promote better sleep quality. In conclusion, physical discomfort and health issues like arthritis, acid reflux, frequent urination, and medication side effects can cause early wake-ups. However, by making small lifestyle adjustments, such as changing medication timing, improving sleep posture, managing fluid intake, and practicing relaxation, these disruptions can be minimized, leading to better, more restful sleep. Fourth, lifestyle habits. As we age, and particularly after retirement, lifestyle habits can significantly impact sleep patterns. One of the most common changes is the shift in the body's internal clock, leading to earlier wake-ups. A quieter lifestyle with fewer external cues like work schedules or social activities can cause the circadian rhythm to shift earlier, making it difficult to stay asleep through the night and often resulting in waking up at 3 a.m. While this shift is natural, small changes in daily habits can help restore a more normal sleep cycle. One of the key factors contributing to early morning wake-ups is lack of physical activity. As people retire or experience a quieter routine, there are fewer physical and mental activities that signal the body when it is time to be awake or asleep. This can cause the internal clock to shift earlier. Staying active during the day is crucial in maintaining a healthy sleep cycle. Regular physical activity such as walking, swimming, or light exercise helps regulate the circadian rhythm and encourages deeper sleep. Aiming for at least 30 minutes of moderate activity every day can support better sleep and help delay the body's natural sleep onset time. Another common habit that affects sleep in older adults is napping during the day. While short naps can be refreshing, long or frequent naps, especially in the afternoon or early evening, can disrupt the sleep-wake cycle. Taking naps too close to bedtime can make it harder to fall asleep at night and lead to waking up earlier in the morning. To manage this, try to avoid naps after 3 p.m. and limit nap times to 20 to 30 minutes if needed. This will help ensure that your body is tired enough at night to maintain a more regular sleep schedule. Meal timing also plays a role in regulating sleep. Eating dinner too early or too late can affect the body's ability to rest. Eating an early dinner, especially without a light evening snack, can cause a dip in blood sugar levels during the night, which can wake you up. On the other hand, eating a large or heavy meal right before bed can lead to discomfort and indigestion, disrupting sleep. Aim to eat dinner at least 3 hours before bedtime and consider a light snack if you're feeling hungry before going to sleep. Finally, exposure to light is another important factor in regulating sleep. During the day, getting outside and exposing yourself to natural light helps reset the body's internal clock, reinforcing the natural sleep-wake cycle. In the evening, reducing exposure to bright lights and screens, which emit blue light, can help signal to your brain that it's time to wind down and prepare for sleep. In conclusion, a quieter lifestyle after retirement can shift the body's internal clock, causing earlier wake-ups. However, by making small changes, such as staying active during the day, avoiding late naps, adjusting meal times, and managing light exposure, you can restore a more normal sleep cycle. These lifestyle adjustments can help improve sleep quality, making it easier to stay asleep throughout the night and wake up at a more appropriate time in the morning. Fifth, emotional and psychological restlessness. Waking up at 3 a.m. is not always a result of physical discomfort or health issues. Sometimes it's linked to emotional and psychological restlessness, which can become more pronounced as people age. As life slows down, particularly after retirement, unresolved emotions or feelings of loneliness can surface in the quiet of the night, leading to wakefulness. These emotional factors often become more noticeable when there are fewer distractions or external activities to occupy the mind. As we age, it's common for the mind to reflect on past events, relationships, regrets, or unaddressed emotions that may not have been fully processed. These thoughts can emerge when everything else is still, creating an emotional restlessness that disrupts sleep. Additionally, loneliness, a common experience for many older adults, can make these feelings more intense. As social circles shrink or family members become busier, there may be a sense of emotional void that becomes more apparent during the stillness of the night. This emotional restlessness can make it difficult to return to sleep once you wake up. The mind begins to ruminate over unresolved issues, creating anxiety or sadness that prevents relaxation and makes it hard to find peace. It's important to understand that this is a natural part of aging, and while it can be difficult, there are strategies to manage these emotions and improve sleep quality. One helpful approach is journaling. Writing down your thoughts, worries, or reflections before bed can provide a release for your emotions. Journaling allows you to process unresolved feelings and express thoughts that might otherwise keep you awake. This simple practice helps clear the mind and create a sense of emotional closure, making it easier to fall asleep. In addition to journaling, establishing relaxing evening rituals can be effective in calming the mind and preparing for sleep. Activities like reading, listening to soothing music, or practicing meditation can help redirect your focus away from anxious thoughts. Meditation in particular helps by promoting deep breathing and mindfulness, which can reduce stress and create a peaceful state of mind conducive to sleep. These rituals provide structure and tranquility before bedtime, allowing your mind to wind down and prepare for rest. Another strategy to combat emotional restlessness is to connect with others during the day. Engaging in social activities, maintaining friendships, or even participating in community groups can help reduce feelings of loneliness. Having positive interactions and emotional support during the day can prevent emotional distress from building up at night. In conclusion, waking up at 3 a.m. due to emotional and psychological restlessness is a common issue for older adults, especially when unresolved emotions or loneliness surface. Practices like journaling, engaging in relaxing evening rituals, and maintaining social connections during the day can help manage these feelings. By addressing the emotional aspects of sleep disturbances, you can calm the mind and improve sleep quality, making it easier to rest through the night and wake up feeling more refreshed.